Welcome to the InfoMullet YouTube channel. If you enjoy this content, please like or share. And if you'd like to support the InfoMullet by becoming a mulleteer, visit us on Patreon. We appreciate your support. Performances, one of the things that came up in a question, and this was in July, and it's a media literacy that I grabbed, it's that there's this question of who fares better. Is it based off healthcare model? And you see this chart here. Here we go. This was a meme that came out in July, and it shows for-profit healthcare in the United States being much higher than socialized medicine, United Kingdom, Canada, France, Australia, Italy, and it looks like they're doing much better. Well, I kind of analyzed this at the time. So some of the problems with this is that it it sort of downplays. First of all, that chart was not created to show that demographic. It was going to show that the U.S. was struggling to contain wave 1.5, where every other country had dropped in wave. It doesn't come from the CDC like it cites. It comes from the European Union CDC. But the claim it makes is interesting. It says countries with socialized healthcare do better in combating the pandemic than those that don't. And this gets right to the point that Jan was talking about, which is a broader look on the effectiveness of response or non-response and the healthcare model of those countries. And it really shows, I think, this analysis, which I did once in July, I'm updating now. It shows that the healthcare model your country is in doesn't matter in the pandemic as much as the pandemic response. And this has been the point I've been hammering now for months. And let's bring up that chart, and then I'll go for questions on this. So this chart shows from left to right on the top here is sort of this scale, this continuum of wholly socialized medicine to entirely private for-profit medicine. And it's ranked 5, 4, 3, 2, 1. So on 5, if a country has a 5, that's universal government funded, NIH, things like that. On a 4, that's going to be universal public insurance, where everyone has insurance, but it's publicly provided. Then number 3 is a mixed system, public-private insurance. And then you can see universal private health insurance and non-universal insurance, where not even everyone has insurance. So, you think about the United States, that's a 1. But then I took these countries, right, and I rated them by the deaths per 100,000 over the course of the pandemic, the healthcare system they had, and the equivalent deaths they'd have if they were US. So I took the per capita death rate and then used that with the population of the US to said, if Belgium, which is something Jan brought up, worst performing country that's bar none. They started out with induced herd immunity, and they kind of went away from it, but they've been struggling ever since. And I think that start really hurt them. They're universal public insurance. It's not socialized, but it's much more socialized than the U.S. in terms of how healthcare is done. If the U.S. had this level of response, we'd be close to 600,000 deaths right now. This is why it's easy to overlook that because I focus on the U.S. and Sweden, I'm using those as responses because I use them in the beginning. If you're talking worst, there are several above the U.S. and Sweden, but we're still on the map. So as you go down this scorecard, as it were, you see Belgium, Slovenia, Italy, 138 deaths per 100,000, universal government funded healthcare, 455,000. They'd be 50,000 ahead of us. Now, the U.S. is not doing good. This is not a chart you want to be on unless it's at the bottom, right? This is a collection of chart where these are the worst performing countries at the top. And you can see the United Kingdom, United States, France, Sweden, we're all in this range where, if this was the U.S., it'd be 100,000 K difference, but none of these are doing well. And you can see here as we go through this, there are non-universal insurance in the U.S. This is a 1. We botched it, screwed it up. We've lost close to 400,000. Here's a couple universal healthcare systems. They botched it. They didn't do well. And you can go down here, and on the opposite end, the countries that are doing much better, these are the relative ones that if they were U.S. populations, look at this, Indonesia would only be at 30,000 or 33,000 deaths. If the U.S. was Indonesia, we'd only be at 33,000 deaths. They've got a non-universal insurance system. Australia, much like the United Kingdom, universal government funded, they'd be at 13,000 deaths. I mean, so Israel, again, it's a universal private health insurance. We're doing midway moderate. So you can see here that the healthcare model your country has is not a good predictor of how you're going to do in the pandemic. The only thing that is a good predictor of how you're going to do in the pandemic is how you treat the pandemic as a pandemic response. It's how you respond to it, how you put in place your capacity, what approach you chose. If you chose induced herd immunity as your start, you're screwed. The countries that pick that and stuck with that, even if they change later, they're still suffering. United Kingdom, Belgium, the Netherlands, Sweden. All of these countries at some point or another experimented with induced herd immunity. Sweden stuck with it the longest, but if you started with it, you're still paying for it. Countries that tried to do the hammer and dance but couldn't get their act together, looking at us, United States, suffering for it. Really, the only responses that have been effective is an effective use of hammer and the dance with countries like Germany, Australia, New Zealand, or a pandemic panopticon, South Korea, Vietnam, things like that. Yeah, Silja's, let's see. Let's go through some of these things. Yeah, Sarah's saying calculus is my jam. Let's all hear it for calculus. By the way, I thought I was stupid at math until I was 33. So this whole like high school math thing, I thought I was one of those dumb ones at math. So it's never too late to learn math. But Eileen, good to see you. Miss Falconberry. Jan, Italy has been doing hammer and dance as well, but is worse than the US in per capita older population. And that's, some of these demographics do skew based off the relative age of the population, things like that. But a lot of it has to do with their effectiveness, how much healthcare infrastructure they have, whether they're able to support it, and that can be related to healthcare model. But the number one thing is the pandemic response. Thanks. Yep, Jan, citing sources. Always cite sources. Great. You'll see that in the John Hopkins, the mortality analysis, that's where some of that data in that chart came from. Jan is from the John Hopkins University as well as the New York Times. Silja saying, I'm surprised Switzerland isn't on your charts from what I read and hear from friends and family. It is very bad. I have to keep it on one page, I'm just picking out some representative ones. So Switzerland is doing poorly. It's not as bad as some of those other ones, but it would definitely be, I would say, in the top moderate realm, relative worldwide. It's probably feeling that impact in a small country like Switzerland, a small country like Sweden. It's a lot more closer to you when it gets bad than something like the US where it's very spread out. Thanks for watching the video. Hope you enjoyed it. If you'd like to follow the Info Mullet, visit us on Facebook or Twitter. And if you'd like notifications when we post new video content, click on the red subscribe button below the video. If you've ever wanted to become a mulleteer and support the Info Mullet, visit us on Patreon. We appreciate the support.